Hi there, you're welcome to Damie RX Care channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you click the like and subscribe button. That way you're able to get alerts whenever we post other educating videos. So a medication that
we'll be talking about today is going to be Flagyl. So this is a common medication that's used especially in our young female patients. It can be used to treat various kind of infection or condition as well. So first thing first, Flagyl is also known as Metronidazole. So it's an antibiotic medication that's used to treat acne. It can also be used to treat a stomach infection called C. diff. It's very C. diff is very contagious, and it's as a result of taking multiple antibiotics, and that kind of shifts your stomach aura, and like you get like a stomach infection that lasts a while, and it's very contagious as well for people who don't know what C. diff is. So it can also be used to treat H. pylori. So H. pylori is also a stomach infection as well. We can also use Flagyl for bacterial vaginosis. So some people also know bacterial vaginosis as BV. So it's a condition that happens in the pubic region of females, where you kind of have this odor going on, and this medication can be used in order to treat that. Also, it can be used to treat meningitis as well as STD known as trichomoniasis, as well as this medication can be given in order to help with post-surgery infection. So a common dose that's used in our patients is the 500 milligram tablet, which is the oral medication that's used twice a day. So it's normally used for a duration of about 7 to 10 days in a young female patient, as I said earlier. Okay. All right. So moving on to the adverse effect of this medication. So the number one adverse effect of this medication is stomach upset. I know, right? It's used to treat stomach infection, and it works more in the stomach, so it can cause stomach upset, as well as it can cause this metallic aftertaste in your mouth. So just be aware of that. It can cause a change in your urine color, as well as loss of appetite, nausea and vomiting, insomnia. So you probably don't want to take it too close to bedtime, as well as it can cause dizziness and tingling and numbness of your fingers and toes. This is probably going to be common in patients who are using it for a long period of time, as well as incontinence. So you might find yourself going to the bathroom more often than usual. Okay. So what are some severe side effects that you need to know about this medication? So it can cause a severe rash, as well as a skin condition called Steven-Johnson syndrome. This is when your body kind of reacts to the medication, and it kind of feels like your skin is burning off, and it can be a form of allergic reaction that your body may be having to this medication. So this is a severe side effect that you want to reach out to your doctor immediately after you start seeing the symptoms. Okay. All right. So another common side effect will be gynecomastia. It's also known as man boobs. So that's when men have enlarged breasts, as well as liver failure. So this medication can cause signs of jaundice, change in your stool color, as well as severe abdominal pain. So if you start feeling the symptoms, it's most likely you need to reach out to your doctor immediately to get this checked out, to make sure it's not a side effect of the medication, in order to be able to stop the medication as soon as possible before the condition worsens. Okay. All right. So another common side effect of this medication is seizures. So if you experience seizure shortly after taking this medication, you want to reach out to your doctor, like I said earlier, and see what they can do about the medication, and make sure that that medication is changed to an alternative or a substitute, to make sure that you're able to clear out the infection and also avoid that side effect. Okay. So what is a no-no? So a contraindication of this medication. So first thing that you want to know as a patient while taking this medication is that you don't want to take any form of alcohol at all while taking the medication. So the medication can cause your body to kind of not process or break up alcohol very well. So it kind of builds up like the alcohol content to a toxic level in your body. And patients usually will get a withdrawal effect from taking the medication if you take it with alcohol. And this can be very severe to the point where there have been some patients that are reported being in coma or died because they were drinking too much alcohol with this medication. So you don't want to take, like I said, any form of alcohol. You want to make sure whatever food you're eating, whatever drink you're drinking, there's no form of alcohol in it while taking this medication. So some of the food materials that have alcohol, for example, that patients probably don't really notice, but they do, is like your Listerine, which is like a mouth rinse, salad dressing or cake mix, ice cream. Some ice cream has alcohol content in it. Some soda have alcohol in it, non-organic coffee, okay? So make sure that you're reading your whatever meal you're eating or whatever product you're taking, make sure you're reading the ingredients before taking it while you're on this medication, okay? It doesn't matter if you're taking the medication orally or as a vaginal gel or like a intravenous or like an IV. You want to make sure that you're staying away from alcohol, okay? Another medication that you want to stay away from while you're taking the metronidazole is disulfiram. And the disulfiram, like I said, is relating more to the alcohol content that I was letting you all know. So disulfiram is a medication that they give to patients who are trying to abstain from alcohol. So they would take this medication in order for them to be able to express a reaction whenever they drink alcohol. So they would get like a withdrawal effect when they drink alcohol. It's usually prescribed in patients that are dependent on alcohol. So if this medication is what you're using, you don't want to use it within 2 weeks of taking any metronidazole product. Like I said, the oral, vaginal gel, IV. When it comes to regular plain alcohol, you don't want to take any of those while you're on the metronidazole until after 3 days of stopping the metronidazole. That's when you want to take it. So if you stop metronidazole on Monday, you don't want to take any alcohol whatsoever until, let's say, Thursday. Okay, so give yourself 3 days after you stop it in order for your body to kind of readjust and, take alcohol well. Okay. All right, so moving on. So for also our pregnant patient, it can be used in pregnant patients to treat trichomoniasis. However, it is a no-no in pregnant patients during their first semester. So during your first semester, it is contraindicated for you to take Flagyl or metronidazole while you're pregnant during your first semester. So take note of that. Whether it's the oral capsule or the tablet, you want to make sure that you don't take any metronidazole while you're pregnant, especially during the first semester. So this is only a contraindication during the first semester. Depending on how much the benefit outweigh the risk, they might prescribe it to you during the second or third semester, but it's definitely contraindicated during your first semester. Okay. All right. So what are some counseling that you need to know, points that you need to know about metronidazole? So you want to make sure that you completely finish the dose. So if it's written for 7 days, make sure that you complete it for the whole 7 days. If you miss a dose, try to take it as soon as possible, but do not double the dose. So let's say you miss your second dose, and you were supposed to take your second dose at 7 o'clock and you remember at 9 p.m., you can still take it. But let's say you missed your second dose and now you're on like at 7 p.m. of the first day, and you remember your second dose when you're supposed to take your 9 a.m. dose the second day. you most likely don't want to take 2 tablets to make up for that. So you just want to take the 1 tablet and just make sure that you complete the dose as much as possible, okay? All right, so like I said, this medication can cause some stomach side effects, so you want to make sure you take it with food or like a small meal. The food can also help mask the taste, the metallic taste that I told you all about earlier from the side effect. And also, this medication can interact with a lot of other medications, such as lithium, that's used in patients who are on antipsychotic medication. It can interact with warfarin for patients who are on blood thinners. Also, cimetidine for patients who are taking it for stomach acid reflux or stomach cramping. Also, like I said earlier, when you're treating trichomoniasis in our patients, you also, as trichomoniasis is an STD or a STD, you want to make sure that your partner is also taking it along with you. So just to make sure both of you are covered. So if you are taking it for trichomoniasis, you definitely want to get your partner to the nearest healthcare professional, or ask the doctor if they're able to call the prescription in also for your partner, so both of you can be treated for that infection, okay? In order to avoid a reinfection due to exposure to your partner again. All right, so I hope this was very helpful and you guys were able to learn a thing or two about what to do and how to go about taking Flagyl. If you did enjoy this video, make sure you hit your like and subscribe button, and I look forward to seeing more of you in our other videos. All right, thank you and have a blessed day.